My name is Daryl Blaney. I am a cancer survivor and I am a fourth-year medical student at the University of Massachusetts Medical School. When I was 3, almost 4. I actually started out having a fever that wouldn't break for the life of me. My parents gave me Tylenol and that didn't touch it. And then I developed hip pain on my left side. And when I started limping around the house with an unbreakable fever, my parents decided it was probably time to take me to the doctor. When I arrived at UMass, they had the preliminary tests already, and they did some additional tests, including a bone marrow aspiration, and found that I did have acute lymphoblastic leukemia. The chemo treatments were large and extensive. Obviously, at that age, you don't really grasp the severity of it. My sister, who is like my best friend and very close, probably as a result of this, her reaction was probably the best and most hysterical because she didn't realize what the big fuss was about. She knew that I had cancer, but I was going to be fine, so she didn't know why everyone was worrying so much. It's been, wow, 22 years since I came off chemo, and I have been 100% disease-free, or cancer disease-free anyways.
The Cancer Center of Excellence is about bringing the most cutting-edge current care there is to patients now, preventing the disease if we can figure out a way to do that going forward, and to invent the treatments of the future.
What can I possibly say about the treatment here at UMass except for superb, fantastic. It was like a second family, like an extended family. And it still is. The standard of care is just absolutely impeccable. When I decided to apply to medical school, I had this weird need to do more to help other people. And from the get-go, the University of Massachusetts Medical School was my #1 choice. It always has been. I'd actually drive by it on Route 9 and just kind of stare longingly up into the neon blue sign, being like, oh wow, how awesome would it be to go to the place that I'd credit with saving my life.
You gotta go, fight, you gotta fight to win, you gotta go, fight!
Being involved in this cancer walk is very, very important to me. It's always been very important to give back to the people that I felt have given me so much, and this is a continuation of that.
The fundraising is critical to our mission because it allows us to perform all of the things that we do. Without the fundraising, without the engagement of the community, none of this really gets off the ground like it can otherwise.
I think fundraisers like this are imperative to further the research in the field, to continue to give kids like me and other people, everyone really, a chance at living the lives that they can, that they're able to.